So how do you reverse that elevating PSA? How do you reverse the suspected prostate cancer, microscopic or not? And how do you shrink the prostate? And so we started to think about how can we do that with the tools that we have today and the knowledge we have today without being dangerous, without being irresponsible, without causing further injury that could add to the problems. And we came up with this idea of injecting ozone into the prostate. Because a lot of prostate hypertrophy, I believe, is due to senescent cells. And as the cells become senescent and they're taking up space, that usually happens because of a mitochondrial dysfunction and the cell can't make its energy.
Right.
And the best way to restore mitochondrial function quickly is ozone. If you can inject ozone into the blood through the whole body, you can change mitochondrial function right away. If you can inject it into tissue, you can change the local oxygenation of the tissue. And for a prostate to get oxygenated, your lungs have to do it, and the blood has to carry the oxygen to the prostate. Well, if you can put 100% oxygen into the prostate with a needle, you bypass the blood, because you're never going to get 100% from the blood, because it gets used up on the way to the prostate. So the prostate isn't getting fresh stuff. So we started to think if we can put ozone into the prostate, we might be able to restore mitochondrial function, reduce cell senescence, and get the prostate to shrink. And sure enough, we can. We've been able to shrink prostates from 120 or 130 cubic centimeters down to 50.
Wow.
That's significant.
That's huge.
And then we started to think, well, what if the PSA is also up and you want to kill, for lack of a better word, prostate cancer? The best tool we have isn't radiation, it's ozone. Radiation has side effects. Ozone, you're going to be uncomfortable, you might even get sick, you might get a fever, those things can happen. But prostate cancer doesn't like oxygen, and prostate cancer doesn't like ozone, and prostate cancer doesn't like mistletoe. You put all them in the prostate, these things can happen. The PSA can come down, and the prostate can shrink, and the senescent cells can become unsenescent, and you can recover without having, before you get in bad enough shape that you need one of those other much more invasive and uncomfortable procedures